Good evening, everyone. Today we are going to discuss a very beautiful and very easy things of the acupressure science. If we talk about the sujok, in the sujok we do the treatment in the hands and feet. If we talk about the acupressure and acupuncture, in the acupressure and acupuncture we are doing the treatment in the whole body. And if we talk about the reflexology, reflexology means when we touch some point and we are touching this point, and from here message passing to the brain with the help of some nerves or nadi, then brain is receiving that message, receiving that information and acting accordingly. So that is called reflex. Then this is the next involvement by the brain, then action taken by the brain, that is called reflexology. So there are many things has been mentioned in the field of acupressure, in the field of reflexology, and everyone should know something, because see, nowadays everyone definitely will be having someone in your home who is suffering with the lower back pain or neck pain or the pain in the shoulder muscles or pain in the knee. If it is a very advanced stage of the arthritis, then definitely you have to go to the doctor. But if it is not the advanced stage, if it is early or intermediate, then definitely you yourself can treat it. So let's proceed now. And I would like to tell you what we are going to discuss in the next 2 days. And even after the 2 days, we will keep on discussing very easiest method of the acupressure and reflexology science, which can be done whether the person is very highly educated or the person is not at all educated. This education is entirely different. So you will able to treat the many common diseases. If someone is suffering with the lower back pain, knee pain, stress, anxiety, you can improve the immunity. So there are very common 14 and 15 disease we can treat very easily. So let's go through and see what we can do if we learn something in the acupressure and in the reflexology. So I am Dr. Hemant Sharma. I am from Vadodara, Gujarat, and I am running here my acupuncture academy. And even I have my application in the Play Store with the name of Master Hemant. In that application, I have my many courses of the acupressure, of the reflexology, of the marma therapy, and all. So this very well-known therapy, very well-known therapy, that is called food reflexology. One day suddenly we decided, I will tell you about the food reflexology. I am running here Panchkarma clinic. Also, I am running here very crowded acupuncture clinic. One day we decided, let's promote our clinic. So how to promote? So what we did, we told to everyone, okay, now please come everyone. We are going to do food reflexology free for you. In that way, we have done the marketing. And we were having only 4 therapists with us and fifth one myself. So I can tell 5 therapists because I was also doing that. So every person was coming to my clinic and we were doing only 5-minute treatment in the feet. And it was too relaxing, too relaxing. Only 5-minute treatment in the feet. Everyone was liking the treatment. Many male and female asked, can you teach us? So I can do to my husband, I can do to my wife, I can do to my mother. Because it's only 5 minutes, but during this 5 minute person was feeling, oh, can you do little more? Can you do little more? Like that. Okay. We'll do little more. Then we were doing 1 minute more. Okay. So in that way, we have done the very good marketing, and 70 people came, and the 70 in many out of 70 people, many people converted as our regular persons. Like, because see, we are doing good thing, but even after we are doing the good thing, but we have to promote ourselves. Oh, that so someone can come and experience us, that whatever we are doing right thing. Then if you like us, then please you can continue. So we are helping you, and you are helping our business in that way. So in this way, this therapy can be completed in 5 minutes. This therapy, the acupressure therapy or reflexology therapy, can be completed in 30 minutes or in 20 minutes. It's as per our availability of the time we are doing for someone. We have to finish in 5 minutes, we can do, but we are doing professionally, and we can do for 20 minutes, 25 minutes. So this reflexology science is also very old, very, very old. It is too old and it is too effective. Whenever you are going in any acupuncture clinic, they are also doing this. Acupressure clinic, they are also doing this. In the spa, in the massage center, and in any health club, they are also doing this. So this is very, very well known therapy, that is food reflexology. So why every health fitness club, why every clinics do this? Because it's very easy to do, and it is bringing the very faster effect. So just I want to show you, there are many points, there are many points under our feet. We can treat anything. We can treat the eye problem, ear problem, lung problem. We can treat the multiple problems. We can treat the thyroid, heart, stomach, duodenum. We can treat the knee pain. We can treat the problems of the bladders. We can treat the hormonal problem and the problem of the testes and the ovary. We can treat the sciatica nerve. We can treat the problem of the colon, constipation, and the liver disorders, many more. So there are too many points, and near about 40 points we are going to discuss in this workshop. And let's see, one by one we will finish the technique, because not only the points, but there is specific technique, that with the help of a specific technique we have to stimulate the point. So if we stimulate the point in the right way, then we can bring very right effect. So near about 40 points, this is the target, because they will cover your body entirely. So these are the points under the foot. Now face is the treasure. Now if you know the face, so do you know that right now we are 184% in the Zoom, but every face is different. Every face is different. Now not only this 184%, if you collect the 100, if you collect the 100 crore persons, everyone is different. Like everyone having two eyes, one nose, lips, and everything is same, but even after that they are different. It's look like miraculous. Like, see, if we are making the chapati, if we make the 1000 chapati, then definitely few chapati will be looking like same, right? But God has designed us so nicely that everyone is entirely different. I can clearly tell, okay, this is this person, this is this person, and even you can recognize. Okay, otherwise it will be very difficult. If we are like chapati looking like similar, if 100 people in the city looking like similar, then it might be very big difficulty. Then suddenly someone is coming to him, you are forgetting, and because of this formula of similarity. So what I want to tell you, every face is different. Why the every face is different? Because every human being is very individual. If we know the face, then just by looking the face, we can find out the person. We can find out the nature of the person. We can find out the constitution of the person. We can find out the habits of the persons. Okay, many times we are going to someone and he is telling many things about you. That is the about the, because everything written on the face. So in the face, we are having near about 39 points. In the face, we are having near about 39 points. And support, I will give you an example. So see one example. If I'm telling about this point, I'm telling about this point. This upper point is the point of bladder. This upper point, the point of bladder, right? And even the this lowermost point is the point of bladder, right? So if we are looking this area, and suppose this area having discoloration, this area having discoloration, this area is pigmented, or this area having some problem, then number one, we can correlate this person. Oh, this person might be having some problem connected with the bladder. But not only this, we have to do little more correlation. We cannot reach on the direct conclusion. We have to do more correlation. So if we do the more correlation, then we can reach on the conclusion and we can diagnose the person very, very easily. In this way, on the face, we are having the point of heart. On the face, we are having point of the pancreas or the diabetes. On the face, we are having point of the stomach. Suppose if on the point of stomach, there is a one red color vial. If there is a red color vial on the point of stomach, okay, the person might be suffering with the heat in the stomach, because red is the color of fire. Red is the color of heat. And the person having more heat in the stomach, then might be suffer with the acidity and nausea feeling and something like that. So in this way, like you can see, the 36 number point is the point of thyroid. So if the 36 number point on the face is having some abnormalities, suppose that area is having some black pigmentations, suppose that area having some different types of color, or boils are there, or something abnormal found there, then the some problem with the thyroid. So it's a very easy. We have to treat that area only. Suppose someone is suffering with the bladder problem, we have to treat this bladder area here, and we have to treat the bladder area here only. In that way, right? So whatever the problem is there happening with the body, we have to treat the area accordingly, right? So in this way, all the points are located on the face. So we can see nowadays there is very common problem. That problem is the diabetes, which is connected to the pancreas. So the 26 number points is disturbed, then we can find out, oh, this person having some problem connected with the pancreas. In this way, we can do the diagnosis. We can do the diagnosis by just looking the face, which is the most important part. Patient will be very much impressed. Why? You even not have hold the hand of the patient, you have not taken the pulse of the patient, you have not asked any questions, and you are asking, okay, do you have some problem in your pancreas, do you have some problem in your thyroid? So it is so impressive. So why knowing the face, why just these 30-40 points on the face, if you know about them, you can treat all the problems which is happening nowadays. If you go through with all these numbers, if you go through with the all problem, so most of the person suffering with these problems only. Someone is suffering with the bronchitis, someone is suffering with the heart disorder, someone with the liver disorder, someone with the stomach disorder, kidney problems, and like that. So doing the treatment on the face, that is called face reflexology or the face acupressure. When any acupuncture doctor put the needle there, then he is telling it acupuncture. But the magic is on the points. Magic is there just on the points. If you know the point, then this is your desire, whether you praise the point, or you puncture the point, or you just do the massage on the point. But in reflexology, there is a no oil, no some lubricant is required. We can just do the massage, we can just do the treatment by our naked hands without applying anything. So on the face, if you do stimulation of some area, suppose I will give you example here. If from the corner of eyes, if you drop down, then you are finding the bone here. Then even you drop down and reaching here. So this is the point just below the bones. So this is the point just below the bones, right? 1 minute. So from the corner of the eyes, if I drop down, keep on dropping down and finding the bone here, still keep on dropping down, finding the lower border of the bone here. Now I am keeping my finger here and doing the gentle massage here. So this point is called the solar plexus of the face. Like with the help of this point, we can treat the knee pain. This point is very good for the knee pain, and this point is very good for the solar plexus or the center of the body. Now, someone is having some pigmentation on this area here. It means the solar is having some disturbed energy. In that way, by just looking the face, we can find out anything. Suppose if we know this is the liver point and someone is doing, many person are doing like this. When they are angry or talking, they are making the furrow like that. So it means they are having some problem connected with the liver. So when the person is squeezing some area of the face, suppose I am doing like this, I am squeezing my liver. Why I am squeezing my liver here? Because my liver is disturbed. So I want to squeeze the liver and want some energy from the liver. In that way, if someone is doing like this, talking and doing like this, means he is activating some point here. Like see, when we are having remote in our hand, automatically our hand is going on the remote and we are changing the channels. In the same way, our brain subconsciously is creating the itching on the area and we are doing something like that. So that is because of this problem, right? So in this way, if we are having the knowledge of these points under the feet and if we are having knowledge of the point of the face, then definitely we can treat multiple problems. Okay, is there is a problem in the voice or it is okay? Okay, fine. Thank you. So look at here. So look at in this way, this is the miraculous thing that we are having too many points under the feet. So God has made us in this way. If we get any problem, we no need to rush to the doctor for a small thing. Definitely we have to consult the doctor when we are passing through with some big problem, but no need to run to the doctor for the smaller problems, because our body is the treasure of points. Look at the feet and look at the face. Not only this, now we are going to discuss few techniques, how to do the treatment, how to do the stimulation. So on the face, I will tell you the technique separately, but let's start with the feet. Okay. So when we are doing the treatment on the feet, so there are some stimulation techniques and we should follow that technique, right? Because we know the target area. We know the target area that if we do something here, then we will achieve the result. This is our target area. But the thing is how to stimulate this area. This is the main thing. Because our feet is the treasure of point. Feet is having too many points. But how to stimulate certain point? So the technique of stimulation is very much important. So we are going to discuss the technique of stimulation. This we are not only going to learn theoretical aspect, we will do practical fully. So don't worry, I am going to teach you practical fully how to do the stimulation. So if we talk about the stimulation, the first stimulation technique is called press and release. It's a very simple technique that is called press and release. Okay, so I will show you demo of press and release, but right now I will show you here in my hand, so you will understand very clearly when we are doing press and release in the reflexology or in the acupressure, then there is a technique. So look at here. Suppose I am taking my hand, just for example, we will go in the feet. Suppose I want to do the press and release here. So many times I will use my index finger and many times I will use my thumb, because at many places, like if you want to treat the foot, then you have to use the thumb. But if you want to use the other side of the foot, any dorsum of the foot, then we'll use the index finger, because the pressure of the thumb will be very higher. Second thing, we are most of the time we are stimulating this part for doing the acupressure. We are stimulating this part doing the acupressure, but during the manipulation, during the movements, we will see how we are going to do. So first technique is called press and release. So just look at my hand. So press and release means press, release. Okay, so how to do correctly? Look at here. Press, Om Namah Shivaya, release. Press, Om Namah Shivaya, release. Press, 1, 2, 3, release. Press, 1, 2, 3, release. So why I'm telling Om Namah Shivaya, why I'm telling 1, 2, 3? Because I have to hold till that much time. When I'm pressing some point, at that point I have to, first I have to press, then I have to hold that point till the certain times, then I have to release. Okay, so press Om Namah Shivaya, release. Press 1, 2, 3, release, or press, release. So in this way we have to press any points. That is called technique number 1. Now the technique number 2, that is called finger walk. Okay, let's see the finger walk, then we'll see the thumb walk. So once we understand the technique of stimulation, then we can directly go to the practicals. So the finger walk and the thumb walk is very important technique in the reflexology and in the acupressure. So what is the finger walk? In the finger walk, our finger is just walking like a, have you seen the earthworm? Okay, how many person have seen the earthworm? How the earthworm walking? How the walking? Earthworm. Earthworm is walking in a very different way, crawling like that, right? That is the walking of earthworm. So in the same way, we have to do the walking by the finger. Suppose this is the earthworm. So look at my finger. So in this way, my finger will walk. So look at here. If my finger will walk like this. When I will demonstrate in the feet, you will understand very clearly. See, when earthworm is walking on one place with the intention that earthworm has to reach somewhere. So it is walking very slowly. So if I want to walk, so I will stimulate this point. This is the very important technique that is called finger walking. And another things we can do with the thumb, because under the sole, under the feet, we are doing the same movement with the thumb. During that time, the same technique can be done by thumb. In this way, initially, when you will start doing this technique, your thumb might be paining because you're doing for one or two one person. Your thumb might be paining, you can change the thumb. But after a few days, after 7 days, if you keep on doing at least for one person, then your thumb will be stronger. Then only there will be one risk after that. Every family member would like to ask, every family member would like to take this treatment from you. On this account, you can take anything back in the return. Okay, you can take some materialistic thing, you can take love if you are doing this technique to your mother, mother-in-law, husband, wife, brother, anyone. So this technique is too relaxing, and no any medication, no any cream is required, no any oil is required, because if we put the oil, then our thumb might slip. Okay, so we are not putting the oil under the feet. Sometimes we are putting oil on the face, very like in the Ayurveda, there are very wonderful oil given in the Ayurveda like kumkumadi tail, kumkumadi oil. It's very good for skin. Kumkumadi oil, it's very good for skin. So we are putting only 2-3 drops oil, or even you can take some cream on the face, because face is very delicate. So we don't want to create any types of redness on the face. And remember one thing, we have to apply the pressure, we have to do this thing very delicately without giving any pressure. If the person is sleeping, the person should not be get up. Your pressures should be like that. You are not doing the vigorous acupressure, and you are not giving any types of pain to the person. You have to remember this thing. So now, third technique, which is very important, that I will tell you now. Slowly, I will introduce you more techniques. So let's see here. So first is press and release. So press, hold, and release. Second is finger and thumb walk. We should remember this. The third technique will be knuckle rotation. Knuckle rotation. What is that? Very, very important technique. So knuckle rotation means, we know these are the joints and these are the knuckles. So look at here. So these are the joints and these are the knuckles. Even I am telling this bone also. So this is the knuckle. We can know this. This is the knuckle. So whether we use this or we use this, I am telling them knuckle. Suppose I am using this, right? So we will keep this bony part at some point, and we do the rotational movement. We do the rotational movement. Few movement will be clockwise and few movement will be anti-clockwise. So just we will do the rotational movement with the knuckle. Some movement will be clock and some movement will be anti-clockwise. This movement is very useful when we do the treatment on the spine. Like in the foot, we are having spine. In the foot, we are having cervical spine, neck. In the foot, we are having lumbar spine or neck, like lower spine. So in the foot, we are having the full spine in the line. So if someone is suffering with the pain in the spine, like pain in the neck region, pain in the cervical 4, cervical 5, cervical 6, or the cervical spondylosis, or pain in the lower spine, like lumbar 4, lumbar 5, S1, or any problem like the lumbar disc herniation. So from top to bottom, if there is any problem in the spine, we can treat with the help of this therapy. This is the very relaxing, a very, very good therapy. On the just after 15-minute session, just after 10 to 15-minute session, person will tell you my lower back pain is now very less. My neck pain is very less. I'm feeling too good in that way. So this is called knuckle rotation. The fourth technique I will introduce you later on, that is little specific technique, that is called closing the circuit walk. Okay. So I will introduce you this technique later on during the practical demonstration, that is called closing the circuit walk. And rubbing means just rubbing. And like when we are rubbing our palm, or we are rubbing the feet in that way. When we are doing rubbing, that is just for warming up. In that way, the most important techniques are technique number 1 and technique number 2. The most important techniques are press and release and finger walk or the thumb walk. Okay, so now just keep these two techniques in your mind initially, and slowly we will introduce more techniques. So now we are coming to the feet part. So very simply, this is the first classification. We can divide whole feet with the help of 4 lines. Okay, so we are seeing here in the presentation, even we will see in the feet this thing. So right now, if we look at the feet, so when toes are ending, that is the line 1, and this line is called neck or shoulder line. So this is the division number 1, right? And this division is very easy division. We can do it very easily, very nicely, without any discomfort, because as soon as our toes are ending, we have to draw this line. So that is called neck line or the shoulder line. And it's clear, whatever problem happened in the upper part of the neck and the upper part of the shoulder, like suppose someone is having problem in the head region, we will definitely are going to treat with the help of this part only, because this is the partition. If the problem above the neck, above the shoulder, then you have to treat in these toes areas, right? So this is the line 1, horizontal division. So right now we are discussing the horizontal division, and after completion of the horizontal division, there are vertical division also. Then we will able to keep each and every body organ at very specific place, right? Now, then in the feet we can see this is the second line which has been told the diaphragm line. Diaphragm line. This is the second line or diaphragm line. So it's also very easy to draw because we have natural depression here in the feet. If you see the feet, we are having natural depression here, and our natural depression is present in this feet part, right? So this is the elevated muscles part. This is the elevated muscle part. So these muscles are elevated and these are the depressed part. So this line is the division between elevated muscles part and the depressed part. And this line is called diaphragm line. Okay, so first, before proceeding, I would like to know from you whether you are aware with the feet. Can you find out this depression? Are you aware with this? Okay, are you looking the curve of the feet? So first we are having elevated part in the feet, then we are having depressed part. Have you seen that? Anyone has seen the feet? Okay, have you seen that? So as soon as the depressed part of the feet is starting, we have to make the division from there. Don't worry, I am going to draw everything in the feet. But right now, if you are 20-30% clear, that's also enough, because we are going to draw in the feet. That time you will able to understand everything. So let's come back here. So in this way, the second division is the division. So this is the second division, the division of the diaphragm line, right? Now it's very clear, like in the human body, what is diaphragm? In the human body, the meaning of diaphragm is who separate chest from the abdomen. Who is separating chest from the abdomen? That is the diaphragm. So what is the meaning of diaphragm line? The meaning of diaphragm line, then definitely lungs and heart we will get here. All the organs found in the chest cavity will be available here, and all the organ in the abdominal cavity will be here. So this is the abdomen. Like in the abdomen we have stomach, in the abdomen we have liver, gallbladder, and all the abdominal organ. So all the abdominal organ will be here. Let's see. I would like to show you 1 minute. I would like to show you the diaphragm line, the live diaphragm line, so you will clearly understand. Let's see here. So if you look at this image, so look at this. So in this image, you can see this is the lower rib area. This is the lower rib area, right? So the lower rib area is attached with the diaphragm line, diaphragm. So this upper part is called chest cavity and this lower part is called abdomen. In the chest cavity, we are having lungs, we are having heart, and the abdominal cavity, we are having many organs like the liver, like the gallbladder, like the stomach, like the pancreas, and the spleen, intestine, and many more. So, if you want to treat the organ in the chest, if you want to treat the heart and lungs, even the ribs, because these are the ribs, many times person is having the pain in the ribs. Sometimes person is having muscular pain, and male female might suffer any problem in the chest, and female might suffer the problem in the breast. So everything in this part we can treat above the diaphragm line, and anything in this part like the liver, gallbladder, and all we can treat below the diaphragm line. So in this way, if we look at here, so look at here once again. So suppose if you want to treat anything, any problem of the chest cavity, like the you want to treat the ribs, you want to treat the lungs and heart, you treat here, and everything you want to treat in the abdomen you can treat here, because this is the diaphragm line and diaphragm is the division between chest and abdomen. So it's a very clear and it's really very easy to treat. And definitely I'm telling you, we are having very wonderful technique that is called closed circuit closed circuit stimulation. If you do the stimulation of this area with the closed circuit stimulation, you will treat any problem, whether this is the problem of the lungs and heart or the breast or chest or ribs or muscles pain, anything, any problem happening in this area. You can treat whole area many times. Someone is asking you, okay, I am suffering with the chest pain, but even you are not aware whether this chest pain is because of the heart, because of the lungs, because of the gas, because of the acidity, because of the muscles pain. Even we don't, then if we are having some doubt, we will treat the chest cavity as well as the abdominal cavity. So whether this is the problem of the gas, acidity in digestion, acid regurgitation, any problem of the abdomen, or it is the problem of the chest cavity, we will able to treat just by these two area. And the very wonderful technique, finger walk and closing the circuit technique, we will able to treat this whole. Now in the same way, if we go little down, we are further going down. So we can see our feet is having natural depression in this part. This is the natural depression in this part. So this is the elevated part of the feet, and this heel is part is also elevated. But in meanwhile, this part is depressed, right? This part is depressed. Okay, in this way. Now, this is the line just in the center of the feet, just in the center. You can measure whole feet and just draw one line in the center of feet. That is called the line of the best line. And this is a very common line because many persons suffering with the problem in the best. So we can treat here. We will also treat on the opposite side because this side is the foot side. We will also see the opposite side and we will also treat your this is the best line. So in this way, in the whole feet, your best found in just in the middle at the level of, like best can be considered at the level of navel. So at the level of navel, you can consider your best. So this is the at the level of navel. So this is the third line, that is best line, right? So the organs below the navel region, because below the navel we are having urinary bladder, So below the navel, we are having urinary bladder. In the female, we are having uterus. Okay, because uterus is little big. So uterus is big. Starting from here, even it is going in the lower part. Okay, so in even the part of the intestine we will see all the things separately, but right now my focus is just the lines, because if we clear with the lines, then everything will be clear. So this is the navel region here. So below the navel, this is the best line, and this is the part below the navel, and this is the part above the navel, right? So in this way, now as soon as this depression part is over, this is the pelvic line, and after the pelvic line, these are the part in the lowermost part of the abdomen, all the genital part, testes, ovary, male and female reproductive organs, and certain parts of the urinary bladder, some parts of the intestine, all part are coming here. So not only here, they are also spreading on the sides. So we will see them in the side view. So what I want to tell you, we can treat the polycystic ovary, we can treat the uterine problem, and when we are touching the point which is the problematic point, like suppose someone is suffering with some problem and we are touching that point, it will be very painful. So in this way, let's see this image now. Now you will understand very clearly. Look at here. So in this way, we can do the comparison very nicely. Like the first line, the first line which I told you, neck and shoulder line, neck and shoulder line. So this is the neck and shoulder line. We can see the head and neck part is above. So with the help of these all the tools, we can treat the head area. We can treat the head area, right? Fine. Now this is the chest area. So any problem of the chest and lungs, we can treat from this area. It's very easy to treat. Just we have to learn the proper technique, and we have to learn the exact location of the point and few different stimulation techniques. Now this is the navel. So I told you this is the navel region here, right? And above the navel, we are having certain part like the liver, like the gallbladder, like the stomach and all. And below the navel, we are having male and female reproductive part. And in this lowermost part, we are having fully genital part, reproductive part, and all the organs below the genital part. So definitely, when we are going to treat the sciatica pain, when we are going to treat the knee pain, we will find the point near about this area in the pelvic area, because pelvic area means below this line, below the pelvic bone. We are having pelvic bone here. I think it's very clear. So look at once again here. So in this way, first we have to remember the stimulation technique, then divide the foot with the help of 4 lines, neck and shoulder line, then the diaphragm line who is separating the chest with the abdomen, then this is the navel, and navel is at the level of navel we have best line. So we have upper abdomen and lower abdomen, and now the pelvic line, and we can tell this is the genital area or the pubic area. In that way, this is the very easy system and everyone can learn. But in this small feet, we are having near about lots of points, 30-40 points. And if you know the point, then you will touch the point, and the person will complain you, okay, I'm suffering with the lower back pain, and many times the lower back pain is because of the ovary. And as soon as you touch the point of the ovary, it will be very painful. And after doing little reflux treatment on the ovary point, the lower back pain go away. Like I have one lady in my clinic right now. So she is complaining lower back pain since 3-4 days. Okay. So one day I just did not focus on any problem. I did the treatment of the lower back pain. She got little relief only. Then suddenly I thought she might suffer because many females might suffer with the polycystic ovary. So she was having some hair growth here. She was having some hair growth here. I thought, oh, she might suffer with the ovarian problem. And as soon as I touched the ovary point on the feet, it was too painful, too much painful. Then I thought, oh, how I missed that point. Then I asked her, okay, do you have some problem of the ovary? Yes, doctor, I am having polycystic ovary. Then I told, why did you not tell me? Okay, I'm taking the medication of the doctor, because when someone is suffering with the polycystic ovary, doctor are giving very different types of medication like the oral contraceptive pills, even the metformin, the medicine used in the diabetes, and there are many medicines they are taking. So when I start treating the ovary point, it was too painful, and I treated that point for 2 days, and now pain gone completely. So in this way, because see, lower back pain because of the bone problem in the lumbar bone, like the problem of the spondylosis, problem of the slip disc. Lower back pain maybe because of the problem of the ovary, problem of the uterus. Lower back pain may be because of the kidney stone or the gallbladder stone. And lower back pain also might be there because of the gas, acidity, and indigestion. So we have to find out the root cause and we have to treat. Then only we will able to treat the lower back pain properly. So, Natasha ji, where are you? Okay. So I think it's enough for today. It's only 1 hour over. If anyone having any questions, then can ask me. You can unmute yourself and you can ask your questions if anyone having any questions, because we will continue this session on the Badness Day. This class will be Monday, Badness Day, and Friday. So all of you are welcome to join Badness Day as well, because Badness Day also it's a free session, and we are going to discuss many like problems happening nowadays. 1 minute only.
Sir, I just joined.
So can you please tell us
Hello.
about the third
Only 1 minute. Only give me 1 minute. Okay.
sir,
So
can you please
yes,
tell us
please.
about the third technique?
1 minute. I will increase the voice. 1 minute only. हाँ अब बताइए please. Yeah.
Sir, can you please tell us about the third technique you have shown?
So like see, we will discuss that technique. We will discuss because see that technique I will demonstrate in the feet. We have to make the circuit. I told that we are going to discuss that technique. You want to you if you we can discuss during the practical session, because if I just do in the sky, it might create
Sir,
confusion.
fourth,
That
fourth,
technique is very
fourth and
useful for
third, I
the
want to know.
mental retarded kids and all. What are you telling? We will discuss.
Fourth technique, sir, fourth technique also once you just show us, no? Once, sir, I want to know that.
No, that will be okay. For technique, which one? Uh, Closing the circuit walk. You're asking
The third one and fourth one, sir, I have doubt.
no. See, first is the
With
press and
knuckle.
okay, knuckle. Yeah. That is third one. Yeah. So, yeah, so third one. I thought because first is press and release, second finger thumb walk, third is knuckle rotation, fourth is closing the circuit walk, and fifth is rubbing. So you're asking about the knuckle rotation. In the knuckle rotation, what we have to do, because these are the knuckles, right? These are the knuckles. So we have to use, suppose we are using the knuckle and we are just moving, but I am also counting this as a knuckle, and if we just rotate like this on certain points, this technique is useful on the stimulation when we do the stimulation on the spine. So we will, because see, this technique you will remember very easily, because when we are going to do the treatment, we will keep on doing with this technique only. So you will be very much familiar with these all techniques, right? Got it?
Sir,
Yeah.
sir,
Please.
if someone has pigmentation under eye, what you said, just below the eye area, the cheekbone area.
Yeah.
So that is because of the solar plexus problem?
No.
Like
Because
this part.
this face is having too many points, right? Too many points. I told about this. I told, but from here to here we have few more points, right? If you are asking just below the here, just below the eyes, dark eye circles, then the dark eye circles is called, now in the acupuncture we are using binary language. Binary language means we are telling something but the meaning is different, right? That is called binary language. So when someone is having dark circles, we are having the deficiency of the kidney, but definitely your kidney is not bad. Kidney is good. Your filtration is good. This is the binary language. What is the meaning of kidney? We are telling as per the concept of 5 element, because as per the 5 element concept, kidney is connected with the sleep, kidney is connected with the bones, kidney is connected with the air condition of the human body, that is cooling down our mind, kidney is connected with the temperament and all. So if under the eyes there is a dark circles, that is representing kidney, right? But we will discuss that.
Sir,
Puffiness also.
Yeah.
Can you
Puffiness.
speak about rubbing technique?
Puffiness.
The puffy-
Puffiness is a different thing. Puffiness. Now, for the puffiness, there is a different theory. We can divide whole body in 3 parts: upper, middle, and lower. So, upper body, now water. What we are having water in the upper body, we are having water in the middle body, and we are having water in the lower body. Every part we have water. Now there are 3 different organs. They have given the responsibility to take care of the circulation of the water. So the upper part, the responsibility of the upper part has been given to the lungs.
Okay.
The responsibility of the middle part has been given to the spleen, and the responsibility of the lower part has given to the kidney. Now suppose someone having puffy eyes, that is means lungs is not doing their job nicely. Now someone is having too much bloating or too much watery like retention in the abdominal area, it means the responsibility has been given to the spleen. Spleen is not working properly. Now swelling around the ankle joint, around the knee joint, in the lower body area, it means kidney is not doing the job properly. So now coming back to face area, now you're asking about the face.
Yes,
So
sir.
it
On
means
the cheekbone.
that is face. Yeah. Upper part means this whole upper part. So upper
Lungs.
part means we have to improve lung energy, right?
Okay.
So if you improve the lung energy, you will able to treat the swelling in the upper part. But luckily, when we are doing the treatment on the face, for whatever purpose you are doing treatment on the face, suppose you are doing treatment for the feet, you are doing treatment for the knee pain on the face, but you are using the face, then your face swelling is going automatically, because ultimately you are doing something on the face, then you are going to get some local benefits, right? In that way.
Thank you so much, sir.
Sir, how do you treat tiredness of the eyes, sir?
Okay, so
They-
tiredness of the eyes, how
Yes.
like see,
Hemanji,
it depends, there are many methods.
Hemanji, sorry to interrupt you.
Yeah, Natasha ji.
Sir, I have Ashok sir online. Can you quickly speak to the
Okay,
students for
please,
2
please.
minutes?
Welcome,
Thank
Ashok.
you.
Yeah.
Thank you, sir.
Yeah.
Ashok sir.
Good evening. Om Namah Shivaya.
Good evening.
Ashok ji.
So I have one good news to share with everybody. So we have requested Dr. Hemant sir to visit Hyderabad, because he's always focusing North India. I said, why not South India? So he's visiting Hyderabad next week, 17th, 18th, 19th, to share ancient wisdom The course name is called Marma Therapy, which is my dream actually. So both the entire Bodhi trainers, whoever is in Hyderabad, they are going to attend this program. With a selfish reason, I invited him, so he's coming. Anybody is in Hyderabad, please utilize this opportunity. It will be a full day course, not like 1 hour and switching off video and relaxing. You know, it doesn't work out like that. It will be 9 o'clock to till evening, 9:30 to 4:30, whole day, 3 full days. He will be sharing. It's an amazing course, Marma Therapy. Marma Therapy. You can go to Google and search what is Marma Therapy, how it works. Yeah. So this is one good news. Second thing is, I requested Hemant sir about special techniques, what he knows. Normally we have face yoga. Now through this acupressure concept, how to make, you know, face more, you know, glowing. What is that called, Natasha, course name?
It's cosmetic facial therapy.
Cosmetic facial therapy. You don't need to apply creams, etc. Right? So that course will happen next month. So whoever is, I am watching everybody, whoever is, some of you writing notes, Anita Mohan, etc. Prardhana Patel is our head of, you know, yoga therapy, mudra therapy, prenatal yoga. She's also attending. All of you can watch her on the screen. Yeah. So continuous learning, and he's sharing, you know, transparently he's sharing most. I have seen this many trainers, they don't tell everything, they keep it hiding. But sir is, you know, Dr. Hemant is sharing everything. It's a golden opportunity. Learn as much as possible from him. Going forward, future is all alternate therapists, you know, will rock in future. Slowly people are losing interest on allopathy. Now, first consultation, second opinion, now third opinion has come into picture. Because first opinion, second opinion, we are not in a position to believe. Third opinion for surgeries. Yeah. So take this opportunity and learn all alternative therapies so that we can help the society in a big way. Thank you so much. I'm sorry, sir. Doctor, I disturbed you. Some of you know me, some of you don't know. My name is Ashok. I'm founder of Bodhi Ayurveda and Yoga Academy based out of Hyderabad. Hemant sir, continue, sir.
Thank you so much.
Thank you, sir. Thank you so much, sir.
Thank you so much.
Sir, हम भी हैदराबाद में
Hello, sir.
So what about for people who are out of Hyderabad,
Out
sir?
of Hyderabad.
Have some mercy on us, sir.
Yes.
Please, Hyderabad is a great city. Please migrate to Hyderabad.
Because I am coming Hyderabad, so if you can also come to Hyderabad.
No, sir. What about us, sir? We also want to join, but then
Oh, Sally ji is not in India. Then it's... okay.
Wait,
We'll arrange
online facilities there, as many things as possible. Online things learn. When you come to India, let us know wherever you are. We will conduct workshop there.
okay. Thank you.
Bangalore, sir.
At Bangalore also we will do. First, let me do this one place now.
Okay, sir.
Okay,
Thank you so
right.
much, Ashok sir. Thanks a lot.
Thank you, sir. Thank you
We
so
are
much.
also in Hyderabad. We will join sir's classes.
Okay.
Thanks a lot,
We have
sir.
to. I want to learn Marma therapy from him. So everybody should learn. Yeah. So all the best, sir. Continue, sir.
Thank you.
Natasha, thank you.
very much, sir.
Thank you, sir.
Thanks a lot. Thank you very much.
Thank you so much.
Thank you, Hemanji.
So shall we close the session now?
No, sir. I have
Hello, doctor.
Yes,
One
Monica ji,
question.
please. Ask.
Hello, doctor. Hello.
Yeah. Hello.
Yes, please. I don't know. Could you help me with a reflexology concerning heart congestion?
Okay. You're from Nigeria. Can you
Heart
repeat?
congestion.
Yeah. Please repeat. Please.
Heart congestion. Congestion on the chest.
Okay. Yeah. Yes, definitely. So today we have discussed
Sir,
the.
how to join classes in Hyderabad?
Mataji,
Procedure क्या
I'll
होगा?
help you with
You-
it
you
little
can-
later, Natasha.
You can message. Call. Okay. So when you want to treat, okay. So not tomorrow. We will discuss about this because in that area only we have to treat. Tomorrow means on the Wednesday. Tomorrow on the Wednesday we will discuss.
Yes, sir. Please tell some point for the migraine, sir.
See, we have to discuss the migraine very systematically.
Goodbye.
Fine, sir.
We will go in the flow and we will discuss everything. So don't worry for that, right?
Okay, sir.
Because we will move step by step and we are going to discuss everything: migraine, knee pain, back pain, acidity, indigestion, how to improve your immunity, and PCOS, stress, depression, and many more things. So don't worry for that.
Okay.
Monica ji, yes, please.
Anji sir. So if anyone is having problem somewhere and when we are pressing the point, it's painful there,
Yes,
like
yes.
both on the chin and the person is having problem at some point, then which technique we will use for them?
Like suppose someone is having any problem in the body, someone is suffering with the thyroid problem, okay, and when you are going to press the thyroid point, it will be painful. Now suppose one patient is coming to you and not telling that he is suffering with the thyroid problem, but if you press the thyroid point and it is, if it is painful, it's so now there is a weakness of the thyroid, and in the future there is a problem might be appear of the thyroid. So if you stimulate the point for few days right now, then you can improve the energy in the organ and you can keep up with that problem. Right?
अरे तुमने बस में लिख किया था
What Monica ji?
Earlier we should use the first technique of pressing the point.
No. It depends on the area. Suppose, see, if we want to do the treatment of the whole chest area, then we can directly start with the finger walk and closing the circuit technique. It depends on the, like, see, if we are just treating the head area, if we are just treating the migraine, then there is a just we will do press and release. That's it. It depends on the area. It depends on the problem.
Even
Like,
for the eyes, we have to press and release, sir. For the
presently,
eyes.
but even if someone is having the very bigger problem, then we have to do the press and release and one more technique which I will introduce shortly. Right.
Okay.
Thank you, sir.
Yeah. Welcome. Yes. Fine. So thank you so much everyone for joining this workshop, and we will meet you again on the Wednesday. See you. Thank you.
Thank you, sir. Thank you, sir.
Thank you.